Hey, welcome to another Topic Tuesday. This is Dr. Mike McCall from Source Health Center. Today I want to talk about sciatica. And what is it? Well, the sciatic nerve is the big bundle nerve that runs from your spine all the way down to your foot, because you can't have life in the human body unless the nerve interfaces with some other part of your body. And so the body is very efficient on how the nervous system lays out. So what happens is the nerves to my foot, my toe, the sensory, if you can feel vibration, all that's a nervous system. And the foot is actually communicating to the brain. What is the local surroundings? All those nerves coalesce together like a giant highway, and they run up the back of the leg to here. And so when people have sciatic, a lot of times they come to me. Sometimes it's not true sciatic. If you have pain on the side of your leg, not directly behind the leg, then you don't have a true sciatic. It's just a kind of a nomenclature, kind of a fine point kind of thing. There's many causes to sciatic, but the most common cause that most doctors will try to rule in or rule out is that you've got a disc problem. So your nerves are come out of the spinal cord through the vertebrae. And when the vertebrae come together, there's a little teeny hole between them, and that's where all of our nerves that give us life flow through. And part of that hole is shared with the disc. So the bone doesn't alter that fast, but when people have pain out of nowhere, you want to look for the tissue that more than likely has altered quickly, which is usually a disc. You can have what you think a herniated disc, irritated disc, these kind of things. The best way to see a disc is an MRI. But the funny thing is about an MRI is you can take 100 people off the street, they've done an experiment, and you can do an MRI on their spine, and 8 out of 10 will show a disc bulge, but they don't have any symptoms. So sometimes the MRI may just tell you something, but it doesn't mean that's the whole picture. So if you've been diagnosed with a herniated disc through an MRI, there's still chances that your body can recover from that injury, basically. And the way things are handled mostly medically is they'll usually refer you for like 6 weeks of physical therapy. Generally, medical doctors think more physical therapy because the interface between chiropractic and medicine hasn't quite integrated. But conservative care, like will it just get better on its own, that type of thing. The next thing would be a cortisone shot where they take the strongest anti-inflammatory made by man, however your body actually makes it, and they go right into the spot that they think is best, and they squeeze that plunger, and hopefully all that tissue that's swelling, catching the nerve, causes a problem. So the reason why, and so that's what happens in their surgery. Well, chiropractic has been successfully treating that as well for a very, very long time. And the way we're trained in school is we need to be able to distinguish at that time with that patient, is it something that needs emergency surgery? The cardinal signs are the patient can no longer hold their foot up, it drops. They lose control of bowel or bladder. They have paresthesia or kind of a numbness kind of right in the crotch area, like a saddle. If they're sitting on a saddle, what happens? That's when we have to go, hey, you got to leave this office and you have got to go and get that taken care of, because you may lose the nerve forever. Subject may be a little longer today because it's a big subject. So many times they're looking at the disc, and and there's orthopedic tests to see. But frequently, especially within my practice, is you can do other things to take that pressure off that area, and one of them is chiropractic. By moving the bones, it takes pressure off the discs. A lot of times people can't get relief from that. But the most common thing is also the biochemistry. What is going on in your body that your body can no longer maintain keeping pressure off that nerve, and a lot of it is inflammation, and it's generally want to look at the diet. But the two biggest culprits, oh my God, when I tell you this, you're going to think I'm insane, but I see it all the time, is if you eat popcorn and eat chocolate regularly, a lot of times that will contribute to your inability to get over your symptom quickly. It's called ileocecal valve. It's something that I fix in my practice all the time. I don't expect you to understand it, but I just want you to know it's there. It's that simple. So if you want to stop your chocolate and popcorn and see if that makes you feel better, that's non-toxic, non-invasive, inexpensive to try. Therefore, it's morally and ethically fine for me to tell you that. So sciatic, it's common. Don't get too scared. Have everything looked at. Actually have a chiropractor take a look at it and give you his opinion. And you can always get your primary care physician's opinion. So I'll see you next Tuesday. Thank you.